So you recently wrote a New Scientist article focusing on research into universal approaches in schools to teaching teens about mental health and how to kind of look after mental health, particularly interventions that involve mindfulness and CBT. And the headline, at least of the online article, is UK schools are teaching teens about mental health in the wrong way. That's the heading of the.
Yeah,
we often
not my
have written
headline,
articles.
but
yeah, exactly. I've written articles before, and they choose quite clickbaity headlines to get people to read. But could you expand? Could you sum up what you wrote in the New Scientist article? I'll put a link in the vlog so people can read it themselves. But yeah, what are the issues with universal approaches that this new research has shown?
Yeah, and it's very difficult to try and cover it in 600 words. But yes, so it's specifically about universal lessons, which is the idea that you teach mental health information to everyone, so a whole class. You're not selecting people in advance who you think might need that information. And it's an excellent idea. And the idea is that because it's quite hard to identify who will end up having mental health problems or who might need them now, if we teach it to everyone, then that's fair. But also it was the idea of preventing mental health problems. You know, if you can teach teenagers coping skills before they're struggling, and then they can use them, you know, when the difficulty arises. So it's a nice idea, and it's cheaper relative to, you know, one-to-one interventions, whatever. But when I started looking into it, I was interested to see that they just don't work very well. Like if they either don't work at all, or if they do work, the effect is pretty small. You know, people might drop a couple of points on a questionnaire measuring anxiety or depression, but nothing particularly meaningful. And then what I'm particularly interested in now is that not only might they not work, but they might actually be causing harm. So they might be causing at least some teenagers to experience more symptoms. There's a couple of studies now showing that, at least in some subgroups of teenagers or in all of them. So I'm now interested in this idea that by teaching teenagers about mental health, especially if you're not following that up with proper support, you might actually just be encouraging them to notice and label their feelings and problems without helping them manage them. And then it becomes a sort of self-fulfilling thing.
And you mentioned, like, if you're helping teens identify and label their thoughts and feelings, but without the proper support, then it might, you know, they might be left ruminating on these negative thoughts and feelings, which might elevate their mental health problems. What might that proper support look like in a school context?
I mean, obviously money is always an issue, but I think a lot of the time they want to be able to talk through their own specific circumstances and problems with someone who will be able to properly listen to them and validate their distress and their problem, and hopefully offer support. I think the issue is, one of the potential issues with these universal lessons is that they just tell teenagers about generalities, but they don't offer any specific guidance about their own problem. And some of them don't have problems to start with, so they don't need the information. Other people's problems are so serious and so difficult that it doesn't really like touch the sides. So yeah, more one-to-one. I mean, one solution is more one-to-one support, but it's obviously expensive.
Yeah, and in terms of the Myriad trial, so the Myriad trial, My Resilience in Adolescence, was this huge randomized controlled trial testing a mindfulness intervention in schools, and that's part of the New Scientist article. Yeah. And what, you know, you and I were chatting before we started recording, and I was saying that I'm an advocate of mindfulness personally for my own kind of stress and well-being and managing my levels of stress as a teacher. And I started to introduce mindfulness in a primary school setting in a very light touch way many years ago. And when the Myriad results published, there was a BBC article, again, shared very widely. It basically said mindfulness for teens does not work. And then, you know, when I dug a bit deeper and I went on the Oxford Mindfulness Research Centre website, they had a kind of summary of the findings. And some of the more positive findings were left out of the BBC report, such as mindfulness seemed to improve the school climate in the schools that received the mindfulness training, and improved school climate is associated with improved mental health. Interestingly, it reduced teacher burnout in the ones that received the training compared to the ones that didn't.
Yeah.
It said it worked for some students, and you've already said that the impact was small if it did work, but it said that those children and young people that practice more regularly reported better mental health. The children taught by the best teachers reported doing the most practice. So there's an element there about good teacher training. So in terms of like this Myriad study, is it about we should kind of abandon in secondary schools, because this was about teens, we should abandon universal approaches right now, or is it more about investigating further, you know, the impact of teacher training quality, whether we identify students with existing mental health difficulties and allow them to opt out of those lessons? Do you think there's what do schools do now, because there are many schools taking these universal approaches, and should they just stop straight away, or should they tailor what they're already doing?
I really don't know, and I don't feel like it's, I don't think we know enough now to say that, the better thing to do now is to stop altogether. So no, I wouldn't advocate for that. I mean, I just think this is going to take a really long time to try and unpick, to understand what is the best thing to do. Unfortunately, it just takes time for, you know, we can learn all the good things that we learned from Myriad and all the what was revealed to be a problem in Myriad, and gradually build on that and refine our understanding. But unfortunately, there's which as academics we would do, but unfortunately there's schools right now who need to know supposed to, and I sympathize with it massively, but I don't, this is why it's so complicated. There is not, and anyone who pretends they have that there is a simple answer to this is misunderstanding the problem, I think.